Welcome back, guys. You've just heard from two of our guests. You've heard from our expert doctor. This is something that is very serious, and I hope you take home the take-home message for today, right, Dr. Gordan?
Yes, correct. So, high blood pressure, it's out there, it's silent. It's one of those things that can sneak up on you and just cause you irreparable damage. However, there are some things that you can do to combat high blood pressure. So there are modifiable risks. A modifiable risk is something that you can change to help you from getting the disease. Now, some things aren't modifiable. Things like age, you're getting older, so that can't be changed. But some of the things that you can change is if you can decrease smoking. Smoking is big. It causes your high blood pressure to get worse. Sedentary lifestyle. So if you can start exercising, start moving. If you have diabetes, you need to get your blood sugar under control.
Definitely.
You need to make sure and go and see your healthcare provider. You need to have your cholesterol checked, because having high cholesterol also predisposes you for having high blood pressure and heart attacks. So the take-home message is have your blood pressure tested from a medical healthcare professional, and then you have your modifiable risk, and try to do things to make sure you decrease those risks and decrease a chance of having complications from high blood pressure.
I think one of the risks that we forgot to mention is the salt intake.
Of course.
And it's very important that we know exactly how much salt we're intaking, and that we could consume what we're supposed to consume for the entire day in one meal. So it's 2.3 grams when you don't have high blood pressure, and when you have high blood pressure, you are only allowed to consume 1.5 grams. So we have a slide up right now. Take a look at it. These are the common things that we eat on a regular basis. You see exactly how much salt is in it. Take a note. You try to avoid things like, soy sauce, canned foods, processed foods. They are more high in salt. I would say try to do more fresh fruits and vegetables.
Yeah, so try to decrease your salt intake, because in your daily requirement for salt, all you really need is 3/4 of 1 teaspoon, which is a very, very small amount. I mean, sometimes you have that in one setting of soy sauce. You can take that entire meal in one setting. So you need to decrease your salt intake, and that will decrease your chance of suffering from high blood pressure.
Take a look at that slide again. So you never know exactly how much salt you might be eating in your everyday diet.
Well, you've seen the chart. So a lot of food has a lot of salt in there, but you don't know about it. So as you know, you have to cut down on that salt intake. It might be better to prepare your own meals at home, and then you know exactly how much salt intake is in that diet for that day. So the apple a day for today is to make sure and have your blood pressure tested. I mean, you might be an athlete, you might be exercising every day and looking fit, but you never know. High blood pressure is a silent killer, and you don't want it to reach the point where it's too late. By the time it starts showing, it has already been damaging some of your organs. So you need to get tested, and get tested early by a healthcare professional.
And for all of you out there who do have high blood pressure, make sure to go and get your urine tested, get your heart tested in the form of an EKG, and get a blood test and an eye test. And for our guests in the audience, we have free blood pressure machines as our giveaway for today, so that you can check your blood pressure at home. So remember, guys, high blood pressure is a silent killer. See you guys next time.